Hai, Assalamualaikum and salam sejahtera. My name is Mazriyana binti Mat Kasim. Today, I would like to present my research paper with the title Knowledge and Attitudes Towards Organ Donation Among Intensive Care Nurses. Before we proceed, this is my content outline. Today, organ donation among the world community is not a new phenomenon, and with an advance in modern medical science, it has benefited many patients with organ failure. Every day, the need for organ donation increases worldwide due to organ insufficiency caused by the chronic diseases. A persistent shortage of organ and inexhaustible waiting lists continue to result in many people dying awaiting transplantation. In successfully promote organ donation, it is important that nurses, especially in ICU, to have higher, higher knowledge and positive attitudes towards organ donation. Globally, the waiting list for patients who needs organ for transplant has exceeded the supply that was donated. The similar scenario also takes place in Malaysia when there is a shortfall in the number of organs available for transplantation. Despite organ transplantation being available in Malaysia since 1975, there were only 86 transplants carried out and a mere 35 disease organ donation made in 2017. Lack of knowledge and personal attitudes among nurses on the concept of organ donation is one of the factors that continue to impede donations and contributed to the shortage of organ donors. In view of that, it has motivated me as a researcher to determine the level of knowledge and attitudes among intensive care nurses towards organ donation. According to McGill 2012, organ donation is a process by which organ is taken from one individual and transplanted to another person where having failing or damaged organ to restore health or reduce disability. Previous study was founded lack of knowledge and personal attitudes among nurses, especially in intensive care units, on the concept of organ donation and brain death is the one of the factors that continue to impede donation and contributed to the shortage of organ donors. Lack of knowledge and personal attitude also due to inadequate information and training regarding organ donations. As consequences, the nurses are not confident to carry responsibility in the donation process. In the study in Serbia, knowledge, attitude, everyday practice, and confidence in the law have been found to be major factors, with most of the study concluded this to be significant in influencing nurses' participation in organ donation. Other study by Osdak 2011, adequate knowledge and level of education increases nurses' self-confidence and were the factor affecting acceptance and willingness to be involved in organ harvesting effort. According to Kasim et al. 2015, in Western countries, majority of nurses and healthcare professionals have a positive opinion about donation. However, a negative finding is very small percentage are practiced in promoting organ donation and transplantation. In Korea, majority of the nurses was agreed organ donation is important in saving a life, but they did not participate and never discussed with the family of potential donors regarding the issue of organ donation. This study was conducted at General Intensive Care Unit in Serdam Hospital, Selangor. The total population of 71 nurses was selected in the study, and however, only 63 of the nurses are participated in the study. Multiple choice questions are selected to assess the knowledge regarding organ donation. The knowledge score was classified in 3 categories, with highest score was considered as having a good knowledge. Attitude of respondent regarding organ donation was measured use 5-point Likert scale. Highest score showed more favorable attitude towards organ donation and lower score is otherwise. To establish the validity of questionnaire, the prepared instrument along with the scoring key and attitude scale was validated by 3 experts who is Director of National Transplant Resource Center, 1 Senior Supervisor in National Transplant Resource Center, and 1 Organ Transplant Coordinator. The finding of the study showed 65.1% of respondents was aged 22 to 28 years old. Majority of them are female with the Muslim religions. Most of the respondents are diploma level and majority of them have been working in the ICU about 1 to 5 years. For the objective number 1, this graph showed that majority of respondents having average level of knowledge toward organ donations. For the objective number 2, most of the respondents in the average attitudes toward organ donations. And for the objective number 3, there is a significant association between age, level of education, and working experience of the respondent with knowledge regarding organ donation, as the p-value for the variables showed that less than 0.05. And lastly, for the attitudes, there is a significant association between age, religions, level of education, and working experience of the respondent with attitude regarding organ donation. In this study, I found out that generally, the nurses in this study have a little knowledge regarding organ donations. Lack of knowledge on our absolute contraindication has been recorded among the nurses. This finding was relatively similar to the result of Collin 2005, which stated nurses were unsure about the exact contraindication for organ or tissue donation. Knowledge on organ maintenance also has been reported at highest wrongly answered among the nurses. Majority of nurses show lack of information on organ maintenance. This finding was similar with the Farahani et al. 2012, which demonstrated most of the healthcare providers having less of information on how to maintain organ before it can be transplanted. In other part, majority of nurses are unable to recognize the meaning of brain death. Late et al. 2013 also discovering the same finding on the concept of brain death, where legal definition has been frequently misunderstood by healthcare professionals. Lack of knowledge on brain death would cause nurses unwilling to identify the potential donors and leading to the miss the opportunity to get viable organ for transplantation. For the attitude, majority of nurses are having average low attitude to organ donation. Majority of nurses agreed and strongly agreed that organ donation is a merciful act and donation organ to another person improves sense of humanity. This result indicate majority of nurses and health professionals have a positive opinion about organ donation. Similarly, the study by Vinci et al. 2020 also reported most of the nurses holded a positive attitude regarding organ donation. Although most of them did not participate in organ donation, but majority of them were willing to donate their organs. In Korea, study conducted by Join and Kim et al. 2012 mentioned that majority of the nurses agree organ donation is an important way in saving a life. However, some of the nurses had never discussed with the family of potential donor regarding the issue of the donation of organ donation. The same finding also revealed by Oluyumbo at 2016, which revealed the proportion of participants who would be ready to discuss organ donation with relation of potential patient for cadaveric donation was low, even though they have positive attitude towards organ donation. In conclusion, knowledge and attitude on organ donation and transplantation are a factor which can contribute to the successful of organ donation promotion. Nurses, as part of the health provider, is fundamental to have sufficient knowledge and positive attitude on organ donations because it is an important part of the chain in organ acquisition. A shared program of studies such as taught during continuous nursing education session can effectively increase nurses' knowledge and positively influence nurses' attitude to discuss on organ donation with the family of potential donors. That's all about my presentation. Thank you for watching and have a good day.